Bismillahirrahmanirrahim. So, if a woman comes to you and you have to manage the group B streptococcal infection, so there are different scenarios and management options. So, first of all, if you are doing, we're talking about the woman, not about the baby. So, if you're doing an LSCS, an elective LSCS, which means that she is not in labor or the membranes are intact. In that case, not in labor, not in labor, you are not going to give any IEP. Always remember, because IEP is given when the baby is passing through the vaginal tract because the flora is present over there. So if you are retrieving the baby abdominally and the membranes are intact and she's not in labor, then there is no role of IEP whether she is known GBS carrier or not or whatever. So for in an elective LSCS with membranes intact and no labor, no need of IEP. We don't care about the history. Second thing is that the woman has been, diagnosed with a UTI in pregnancy during the antenatal period with GBS. So during the antenatal period, when she is diagnosed, you're going to give her antibiotics for that infection, the GBS, and then you are also going to give her antibiotic prophylaxis intrapartum during labor. So both of those things. But in the antenatal period, if she is diagnosed for any other thing as a colonizer via the vaginal swab or the rectus swab, then in that case, no antenatal treatment, but only IAP needs to be given. Okay, so now she comes to you. So you are in the labor room, and a woman comes to you, and she's a woman, and she comes to you, and she is right now in preterm labor. You are going to give IAP. We don't care about the history in this scenario. Then again, a woman comes to you in labor room, and you are taking history, and she tells you, doctor, my previous baby was infected with GBS. Previous baby had a diagnosed infection. You're going to get scared, you're going to give IAP. And then she tells you, again, a woman comes to you and she tells you that I was in my previous pregnancy, I was a colonizer of GBS. Baby was not infected. Everything was fine, but I was a colonizer diagnosed by a swab or anything. Then in this case, you have two options. Either you offer IAP or you offer bacteriological screening at 35 to 37 weeks if it's a single fetus, or 32 to 34 if this is twins.